you spoke really very well. I think you've covered everything, most of it.
But my question is still unanswered.
Dr. Vaishali, you truly deserve a big hug for this session. It was excellent, fabulous, and the best part which you have covered is the nose which is to be given in hypotension. Plus, when the constitutional is not working, and you have to give an intercurrent, the tuberculinum miasm, and for ringworm, the bacillinum. Now, n number of medicines have been given, okay, and still it is not working. There is a block. So when do we consider that? That also well covered that if there is a family history of tuberculosis, cox, then you must consider. So if we have nosodes set in our box, but randomly it is not to be prescribed. Only when there are symptoms. I had attended a session by Dr. Praveen Jain in Hyderabad as well. He too said only if there are indications then you will be giving. So that is very well covered, and the way you have managed all the cases, excellent, fabulous. और ये सेशन का हमको रिकॉर्डिंग जरूर चाहिए. डॉक्टर अलका और डॉक्टर वैशाली, बहुत ही अच्छा लिया है आपने. थैंक यू सो मच. और इसमें एक बात है,
उनका एक्सपर्टीज है ट्यूबरकुलिनम की.
और एक दो पॉइंट ऐड करना है कि tuberculinum child has got fond of cars, is very fond of cars. उनको कार बहुत अच्छा लगता है. And the point which you said, what you have mentioned in your PPT, gentle. I was like wondering how can they be gentle, but then the point you said that tuberculinum वो मस्ती और डिस्ट्रक्शन कर देगा, डिस्टर्ब करने के बगैर भी. वो मोबाइल हाथ में रहेगा, वो तोड़ फोड़ कर देगा. tuberculinum ये है, लेकिन tarantula रहेगा, वो थोड़ा कनिंग है और थ्रेटन करेगा. मोबाइल फेंकू, मोबाइल फेंकू, फेंक देगा. tuberculinum रहेगा, he will destroy, destructive. लेकिन tarantula फेंकू, वो खिड़की के पास रखेगा मोबाइल. फेंकू फेंकू, threatening and cunningness is based in tarantula. This is the main point of differentiation which will be very helpful. The additional point of latent sora. Latent sora when triggered, the exciting cause. और दूसरा ये देखना है कि nebulization का frequency कम होगा. वो point आपने बहुत ही अच्छा है. तो समझो 10 बार nebulization करना पड़ेगा. Next time the frequency has to reduce. Thank you so much. All best wishes.
Say one thing, that not a single patient of mine required nebulization ever after tuberculinum was prescribed, and that was an absolute eye-opener. And the mothers, I think tuberculinum has given them a new life, because there is not a single failure.
Dr. Padma is asking tuberculinum is chili or hot. It is chili. Okay? And
chili also, it is the miasm that is important. If you have family history of tuberculosis, repeated cold and cough, then you go ahead and give a tuberculinum either ways.
And that phosphorus has got traits of tuberculinum. That was also a very good point. Basically, the miasm, sora, psychosis, and syphilis. The additional miasm are the diseased miasm proper. Like tuberculinum, ringworm, malarial. That is, but the base is sora, psychosis, and syphilis itself. और जो है, जो आपके tuberculinum और ringworm है, वो actually तो disease है. That was additional one, but original one was sora, psychosis, and syphilis. So when the latent sora is triggered, that is called as the hydra monster. बराबर है? तो point सब आपने cover कर दिया है. Organon base और जो है उसमें main ये देखना है कि when the energy is not channelized, that is the reason they are why so much destructive.
Okay. They are very high on energy.
So
and the specialty of tuberculinum anger is it is directed maximum towards their own parents.
Yes. Why? Because of oppression.
We have few more.
Because of domination from the parents.
Sorry to interrupt, ma'am. We have.
Thank you so much.
Coming from Dr. Vaishali, I suppose. Dr. Vaishali has raised her hand.
Yes, Dr. Vaishali.
Yes.
Yeah. So this was an interesting topic, and I would just like to tell you, I did my MD in the role of anti-miasmatics in pediatric asthma cases. So there were so many cases, like in the OPD I used to sit and children like 6 months, 1 year, we
Your voice is breaking, ma'am.
Can you hear?
No, no, no. The video is stuck.
Now can you hear?
No, it's still breaking. There is some internet issue. Maybe you can change the internet connection, take your hotspot. That may work.
Yeah, I think hotspot will work better, yes.
Till that time, we'll take the next question.
Dr. Mona, we need, Dr. Mona has to talk.
Yes, good evening, Dr. Mona. Please.
Yeah, good evening, Dr. Alka, and good evening, Dr. Vaishali. So, everything is perfect what Dr. Vaishali spoke. I would like to just add a few things, as in my understanding with tuberculinum started after I joined CMP as a teacher. So, as I was associated with Dr. Nimish Mehta and Dr. Devadiga, so I used to keep on seeing Dr. Nimish Mehta using tuberculinum very, very frequently. So it was his favorite, and I used to keep on wondering why he keeps on giving it so frequently. In fact, he used to give 1M every 4 hourly in fever cases, or degenerative osteoarthritis, seronegative arthritis. All those cases he used to keep on giving, and I used to wonder how he can give it so frequently, whereas I used to wonder, one dose is like, it's a sufficient thing, just 1M, one dose. So, but he used to give it with a lot of confidence. So, seeing him practice, I also gained that confidence, and I started incorporating these things in my practice as well. What I have observed in my 25 years of practice is that tuberculinum definitely, as Dr. Vaishali said, that it acts as a catalyst. But what, in my opinion, there is one more thing which is I'm adding, is that it also acts as a very good precursor in complicated cases. So I had a patient who was a patient of Sjogren's syndrome. As you must be knowing that it's an autoimmune disorder. So there she was on steroids and everything, and but so as I had to taper her steroids, I never wanted to give her constitutional that time, because the entire picture was absolutely in a complete mess. So what I did was that when I was tapering her steroids, I started giving her tuberculinum. And as I gave her tuberculinum, that moment I started tapering off her steroids. And at one point of time, after a month or two, I tapered off her steroids completely, stopped her steroids, stopped her painkiller, and then I took her entire picture, and then I prescribed her constitutional along with tuberculinum and with the constitutional. That worked beautifully, and now she is completely off painkillers. She is on remission phase, and she is much better, and she is not taking any steroid or any painkillers. So that was one thing. And now, past almost, I would say, since COVID time, tuberculinum I have started using in millisimal potency with very good results. So just a few months back, I had a patient who had very bad allergic rhinitis, and I had given her, she was constitutionally lycopodium, I had given her for almost 6 months. She was much better, but then suddenly something happened and she was stuck at almost 60%. There was no, she was not better at all, complete nose block, everything was happening. And that time I said, let me just check her IgE levels. Her IgE levels were 2400. So that time I said, nothing doing, I have to give her tuberculinum 0/1. I started giving her tuberculinum 0/1, and within a month, everything got cleared. She still keeps on taking that medicine, and she talks about that medicine. ये तो मेरी रामबाण दवाई है. So I talk about tuberculinum as a magical remedy. It's a wonder drug which will help you through lot of cases, complicated cases. Even I give in degenerative pathology. So it's not only tubercular, it's a psychotubercular case where you can give tuberculinum and it helps wonderfully. So I would talk in detail later on sometime when I get an opportunity to talk. But today was Vaishali's day, so I'm really happy that she covered everything. But I would definitely would want to talk about my cases which were really complicated, and tuberculinum has helped it very well. So thank you so much for listening. Yeah.
Ma'am, this was your day. I took the same topic as nosodes are very important. We will want to learn from you for sure. But I have a question actually. That while we are giving the constitutional and the anti-miasmatic, where in organon has this reference come? Because when they say intercurrent, it means you give your constitutional and then give a nosode as an intercurrent, then go back to your constitutional. I don't know where it is mentioned that you can give both together, although both together work fabulous. So I'm searching for the reference. Can anyone help me? Dr. Mona?
I would definitely go back and see, Vaishali. I'm not very sure of that. I will definitely read my organon textbook and get back to you. But there is a reference, I think so, because definitely it has been used by our professors and our seniors as well. And definitely they have not. Sorry.
Why I want the references? Because we will be presenting the cases, and then we need to have a good reason to do it, because in practice it has helped like anything. There are no failures. But when I try to go back to the main book, I am not getting the reference.
Definitely, I'll get back to you. Definitely.
I just want to add this first and I'll get my voice. Is my voice audible?
Yes, now yes.
Yes, ma'am.
This question which you asked, Vaishali, I mean, there are certain references where you find that he mentioned about the lucid interval. Okay, so when you want to give something deeper than the constitutional medicine, probably we need to just wait for the system to come back to the original state and then go deeper and then think of any kind of a miasm. So I think lucid intervals are better to prescribe our intercurrent anti-miasmatics, isn't it?
No, ma'am. As I was asking, let's say this patient is on nebulizer. I am giving tuberculinum. The constitutional is pulsatilla. So I would give pulsatilla 1 dose per week and tuberculinum every Sunday or one Sunday in a month. So at a time, I am giving 2 remedies. Then only TUB would help. So then the intercurrent has to be in between. Then there is no constitution to be given. But both of them given well, only tuberculinum will do better. So where is the reference that you are allowed to do this? Because Dr. Hahnemann has never advised using 2 medicine at one time, although they are working beautifully.
You are saying at one time is, you are not giving it at one time, you are giving one on one day.
No, not exactly one time. No, not even one day. Let's say on Tuesday I give pulsatilla, on Saturday I give tuberculinum, again on Tuesday I give pulsatilla.
So these are going to complement each other, isn't it?
But what is the requirement?
When you are saying that if pulsatilla is a constitution, what is the need of tuberculinum?
Yes, and if tuberculinum has to be intercurrent, then after that, intercurrents are to be used. I'm giving pulsatilla, the case is stuck, it would not move, but I need the case to move, so I give a TUB and continue with my pulse.
I'll just go back to what I was saying. Like when I decided to do the MD, I used to get a lot of cases called wheezing, and as you said, people coming to the allopathic section for nebulization. Then they would, after all that, they would come that this stuff is not going and this child is having a lot of wheezing at nights or day and he's cranky. So plenty of cases, 50, 60, 70 cases of children starting from like maybe 2 months, 6 months, 1 year. And you know that, sorry to say, the modern medicine people don't bother, what the age of the child is. They just start with their antibiotic doses and steroids and whatever possible. So I decided that, okay, since I have a lot of data on this, I was going to do my MD on this particular topic. There was one very interesting case. This child was about 2.5 years, and the mother said since a long time, maybe 6, 7, 8 months, she was having this asthma problem, bronchitis, and the whole family history was so complicated. The mother's side, everybody had issues. The father's side, including the parent, everybody had issues. So, like in my practice, I found the earlier the child starts getting lower respiratory tract infections, that means the system attack is like the deeper, the pathology is deeper, the faster in your life, in the evolution, it is indicating there's a lot of load, lot of genetic or hereditary load, and that's the time, like you said, tuberculin and anti-miasmatic intercurrents are going to have excellent roles. So in all these cases, which I generally we write 30 cases in our MD, so I think most have been 70 to 80% were all tuberculin anti-miasmatic. Very few were SORA, and a lot many were like had to give Tuja, and very few Medorinus. So my experience was the faster in your life you get pathological issues related to this, it is indicating more and more towards the anti-miasmatics.
Yes, doctor. Yes, Dr. Vaishali.
Yeah, so that's all what I wanted to share regarding this.
Thank you.
And yeah, one more thing you said, this is a favorite of the ICRs. I did my ICR in 1988-89. Okay, so at heart, I'm still an ICR, and definitely it's all our favorite. Those and all are, every case, I feel every case needs a anti-miasmatic.
Ma'am, after seeing tuberculinum, I am scared to say that if we know the miasm well and use the anti-miasmatic, then probably our constitution will be required much later for whatever is remaining. Because they clear up the case so well that sometimes after giving tuberculinum, I have not had to give them medicine only. So that is a very striking thing which I am seeing in practice now.
We have Dr. S.B. Who has raised her hand. Yes, Dr. S. I do not know her name. Dr. S.B. Please raise your question.
Yeah, good evening everyone. I am Dr. Sneha. Dr. Vaishali, as you were saying that you need some reference where constitutional as well as this tuberculinum are given together. So I remember that somewhere in Kane's lesser writing, where Kane has shared his cases during his practice and all, he has used tuberculinum in many cases, especially for respiratory complaints and adenoids also. And that too, he has used it in very repeated doses, high doses, and repeatedly. So even I am just trying to find out that how means if we know the background of Kane's philosophy and this thing, Kane has always advised not to use repeatedly any medicine, not in repeated doses, and that too not to start with very high potencies. But if we, on the contrary, read his literature, and especially the cases he has done, we find that he has used tuberculinum very frequently, and that too in very high potencies. And also he has used constitutional medicine along with tuberculinum.
Yes, okay. So this is in lesser writings, right? So I'll find out the reference and I'll put in the group as soon as I find it, because it's a very important reference. Yeah. Thank you so much.
If I get from my end, I will definitely share it.
Another important share we found Dr. Mona when she said that she had started using it in the millisimial scale and LM potencies and all. So that's an interesting thing. We can also work on this and find out our experiences, with repeated doses. Because we are generally skeptical. No, let's start with 200 or let's start with 1M. So this is also another good input. We can also try it in our OPDs.
Yes, I have one question from Sonal Patel here. Dr. Sonal, please raise your question.
I just want to say, even I have used tuberculinum very frequently in children cases, and I was working with Dr. Marcus, so he said Indian children are mostly exposed to the tuberculosis, so you have to give tuberculinum repeated doses to the children, each and every child. So even in my practice, I have seen tuberculinum. I think you have to give to each and every child as an anti-miasmatic, and even in kids, you can repeat frequently, once a week at least, 200. I have seen very good results with the recurrent cold and cough, allergic rhinitis, adenoids in all cases.
So is that like an immune modulator?
Yes.
I have a question to my seniors, that while silica and phosphorus both have predominant, let's say 70% tubercular features, why was another tuberculinum required? Why did they not clear up? Because they have the same dominant miasm.
But tuberculinum is a um, from the it's like as a vaccination kind of thing only, from the source only.
Yeah, but
it's
if
a
you
no
give
board.
full phosphorus and full tuberculinum, it's almost the same picture except a few things here and there.
Maybe because the source is different.
Yeah.
Maybe because the source is different.
Phosphorus is metal and tuberculinum is nosode. It is like a vaccination. It is works from the tuberculinum product only.
See, what I'm coming to is, if in the case of molluscum it was only the miasm where it was stuck, then it is, when you call phosphorus a triamiasmatic, the predominant miasm is tubercular. So it could have helped the case, and why would it not help? If it was just a miasmatic that was required.
Oh, but when the infection comes recurrently, then this nosode, if you give it acts very well.
Yes,
it's a deep rooted
action. It is just I'm thinking why it would happen. The action is very clear. There has not been a single failure after tuberculinum, and there has not been a single nebulization continued, nor a use of antibiotics required after tuberculinum. It has been a blessing to the kids, to their mothers and to their families. But these are questions little unanswered, that while we have our polycrests with all the depth acting as the triamiasmatics, why do we require anti-miasmatics also?
See, now children are also exposed to so many vaccinations and all this thing also. Food is also like that. So nosode acts very deeper level.
Okay.
Even I would say I am treating so many cases of hormonal imbalance. So I've seen it, like medorinum also act very well. Thuja, medorinum, in such cases where we can reverse the PCOD, then the ovarian cyst, all this thing you require their nosode. And I have used like even frequently also. It is not like you have to wait for 3 months, high potency you have given. Like you can use even LM potency also I have used, and it gives wonderful results.
Medorinum, Thuja, which one?
No, it depends on the symptoms, but medorinum and Thuja, according to the symptoms, it is miasmatic remedy. So that according to case you can give, but these are the deeper acting medicine you need to give. I have seen like constitutional medicine, somewhere it stuck, and when you give this anti-miasmatic remedy, the case clears up. So I have treated the girls where they have not got the menses 1 year of 1 year, 1.5 year, and I've given constitutional medicine, it didn't work, but I've given medorinum and her menses have come.
I have one question here actually. Today, if my medicine would not work, I would see the complementary, I would retake the totality and give some more medicine. With how would I realize that the medicine is correct when it has not shown results? When we get the result, we say that the medicine is correct. So if I give a medicine and don't get the result, I'll change. And then probably after the 7th medicine, I'll say, oh, probably it's the miasm, and then give the anti-miasmatic, losing so much time in between.
I mean,
no, sometimes even I have start case with the direct anti-miasmatic also, like Thuja or medorinum. Few symptoms have come, I have started my case with that nosode only, and then
so
the mind becomes very clear.
My actually question is, can we have a, let's say, a habit or a protocol where We take the full history, take the first, see what is the miasm, give an anti-miasmatic, see what stays after that, and then prescribe the constitutional?
You can do that.
Because there are a lot of
Sometimes-
doctors who do it.
No, but I have treated so many cases where, this thing has helped me. I had a case where, I was giving her phosphorus, like typical symptoms of, I can share that case also. So it wouldn't help. Then, I given Uforinum also. And then I gave her tuberculinum. Then it cleared up and she started getting her menses.
Okay.
So it happens.
Like I said, Dr. Vaishali, like when we are taking the case, in the beginning itself, when you are collecting all the family history data, if there is too much of a load in the hereditary and the genetic, that itself indicates that you are going to need the antiparasitic intercurrent. You are going to need.
Okay.
But when is the question? Like you are suggesting, even before constitution, why not we give that? But
Yes.
see, what we have gone through, the theories and the books are saying, only when there is a block you feel, that is the time you introduce the antibiotics. Okay. Now, when we talk about blocks, you are giving the constitution, but you are not getting the result that you got in the molluscum. Now, when you talk of the molluscum per se, we might think it would go in the psychotic miasm. Is it also a fungal? Because if you see the pathology, is it fungal? Will it go for
Viral.
or viral? So when there is a question mark, like you said, you were wondering what is happening. I had a case who had a girl who had a wart over here, and considering just a wart, I used to give her puja, in a week 2-3 times, you would take. She still kept on coming with that, and they used to bleed. Can you imagine, as you said, this thing went away with tuberculin, the bleeding, because the overgrowth is definitely psychotic as we came to know, but the expression was a tuberculin expression, so that went away with tuberculin, the bleeding water.
Great.
So I think we should go for the, like the screening, as we say. In the beginning, only go for the collection of data, what is there in the family history. If you feel there's too much of load, definitely they're going to need.
Dr. Mona has something to say.
That was a great input from Dr. Vaishali.
Yeah.
Very, very useful. Yes, Dr.
Just last thing, as you spoke about, Vaishali, as you spoke about, should we start tuberculinum in the beginning itself? I would just want to add that as homeopaths, we normally get patients after there are a lot of complications. मतलब 10-15 साल सब यहाँ वहाँ जुगाड़ हो गया, उसके बाद फिर होम्योपैथ याद आता है. तो फिर वो होम्योपैथ के पास इतना सारा मतलब कचरा जमा हो गया है पेशेंट का कि he has to clear that entire thing. So in such cases where you have an entire mess, I would that time suggest to give tuberculinum. But unless and until, if at all that is not there, then you can safely start with your constitutional and then think of giving tuberculinum if needed. Not necessary that you need to start a tuberculinum at the beginning. That is the only thing.
Yeah, that's what even I
Yes.
was telling. Like when the case you can't understand and there is too much mess, you can start with the machines.
Thank you, Dr. Sona. I have one question actually for Dr. Mona. When do you decide not to give 1,000 and when do you go to the CM of the same medicine? What are the criteria?
You are talking about tuberculinum as such?
Yes. When would I decide कि 1,000 नहीं देना है, millisimial देना है? What would be the criteria?
So basically, there are patients whom I have given along with constitutional tuberculinum 1M दिया है. फिर बाद में ऐसे after that maybe I have given 10M also. In this case which I was talking about in allergic rhinitis, I gave her lycopodium. Lycopodium worked. Tuberculinum 1 dose I had given her per week and that did not help. So in her case, I understood that the sensitivity had become very high. Plus, she had that time conceived. So I thought it is better to give her a millisimal potency, which will help her through her pregnancy also. At the same time, it will not cause any aggravation, because millisimal potency is something which is absolutely safely can be given continuously, repeatedly. So millisimal 0 by 1 twice a day for 15 days, 1 month, I could give her safely, and I wanted her pregnancy to be very smooth and without any complications and without all these sufferings of her allergies. So that was the main aim. So in understanding when to give 1 m and then 10 m, I do this way only, that I try to understand the sensitivity of the patient and then decide whether to give 1 m, 10 m or millisimal.
Okay. Thank you, Doctor.
Can I share a case of my son?
Yes, ma'am.
Yeah. So my son was 3 years old and he had a cough because in my house the work was going on, the renovation work, and that time I used to work with the doctor master. So I had given anti-cat, focus peptide with the symptoms, but nothing worked. And then I asked sir, and he said just give tuberculin 200, and his cough went away like magically, just like a magical. And that time, sir told me that tuberculin is so much in India. Like every child should get at least once, like a vaccination. You can give the tuberculin because as soon as first vaccination, here we give is BCG.
One question from my side. Would you use tuberculin more in case of allergies or more for chest infections? Because I have used them 95% plus in case of allergies and asthmas, not so much for infections.
Both.
For both you can.
So infections as in tonsillitis?
Yeah. Adenoids also.
But when you have
But not in acute. Acute, no, not in acute. So acute, when the picture is clear, you have to give the medicine, whatever the characters are coming. This you can give, like, yeah. And when the constitutional is not working, then you can give the tuberculin.
Okay.
And ma'am, which potency?
So 200 usually. If you want to do 200 once a week, you can repeat. If it is not working, then only you can repeat.
At this moment, I just remember what Dr. Kent had mentioned. Brighter children are born to parents who have got suppressed syphilis in their, their own younger ages. That means something which is suppressed in the earlier generation is definitely going to get transferred to the next one. Sometimes we also ask, do you have a history of any heart disease? So the patient says, yes, my father had this. We definitely ask, at what age did he have this, say, triglyceride issue, cholesterol issue, or ischemic heart disease? So if somebody says that my father had an issue at the age of 70, we don't mind it so much. But if the patient says that my father had an heart issue at the age of 40, it does matter. Earlier his exposure to all these diseases and he has been suppressing these issues, it's gone to the next generation already. So I think that is, when she said that, in India there have been a lot of histories during that time with tuberculosis and so many infections, not more, and have been untreated and have just gone from one generation to another. And that's how we see so much of mass picture.
Yes, thank you so much, Dr. Vajanti, for the valuable feedback and inputs. Do we have any more questions from the audience? Yes, Dr. Vaishali would be willing to answer any of your questions.
Just wanting to compliment, like, one day after the other is getting better and better. So good wishes and good luck to the group.
Yes, and thank you, Dr. Vajanti, for actively participating in the entire period. Even yesterday's session was really good. Even today's session, your inputs have been really valuable. Thank you, Dr. Vaishali, for the wonderful session. We have learned a lot was very practical and useful. I am sure the other participants also have gained a lot. So hope to meet you all once again tomorrow, same time, 8:30 for the next webinar series. So good night. Bye-bye.
Thank you, Dr. Alka. Good night to all. Let's keep the momentum going.